Welcome to Becker's Health IT and Revenue Cycle Management Virtual Forum, and thank you for joining our featured session, Get in the Outsourcing Game, How Health Systems Have Utilized Outsourced RCM Services to Meet Their Overall Business Objectives, sponsored by Access Healthcare. Access Healthcare is one of the largest independent offshore revenue cycle management companies and provides business process outsourcing and robotic process automation tools to hospitals, health systems, providers, and payers. Access acquired Pacific Global in 2018 and combined operates from 19 global delivery centers in the US, India, and Philippines and employs over 13,000 associates committed to bringing revenue cycle excellence to their clients. My name is Paul Rita. I am a director in the healthcare industry group at Alvarez & Marsal, and I'll be introducing our panelists shortly. But before we do that, a quick housekeeping item. If you have any questions along the way, please submit your questions in the Q&A box you see on the screen, and we'll be sure to connect with you after the session is concluded. Let's now introduce our panelists. We have Desmond Jackson, Senior Director at Johns Hopkins Health System, Sean O'Rourke, Vice President, Holy Name Medical Center, and Kumar, Shwetabh, CEO, Pacific Global, an Access Healthcare company. Let's go ahead and get started. Let's start by first understanding why and how Johns Hopkins and Holy Name made the decision to partner with an outsourced vendor, and what were the deciding factors in selecting your vendor, and who drove the decision to outsource in your organization. Sean, can you start us off, please?
Yeah, Paul, our original outsource decision was made almost a decade ago. And at the time, Holy Name had a small number of hospital-based physicians that it was billing for through its hospital business office. The hospital was just starting to acquire ambulatory outpatient physician practices, was going to be a strategy it embarked upon. And they knew they didn't have the technical expertise nor the staffing to do it. And it was a big decision for Holy Name. Holy Name's a do-it-yourself type of place. And so ultimately the CEO of Holy Name had to endorse the process. Global Pacific was selected back then. Their transition went very well. I arrived about 5 years later. And at that point, the network had grown fairly significantly, but there were some pretty serious questions being asked by governance about the network itself, and is it meeting its strategic purpose, and also all the infrastructure support of the network, including its revenue cycle relationship with Pacific. And so I dove into that for a good 5 or 6 months. Pacific seemed to be doing a pretty good job. KPI indicators were all pretty good. But I did a deep dive, okay, including, competitively bidding the network, again, to outside vendors. Part of what I did internally with my team was to reconstruct at a detail level specific accounts that had been closed, that had went to zero, that had been paid, to try and see if there was anything that could be done differently or better that Pacific could do, that we could do. And I gave the same opportunity to the outsourced vendors. What came back was actually very positive. Pacific's doing a very good job in terms of cash realization, cash collection, timeliness, all the key things. Nobody really had, from the outside, any suggestions to the otherwise. The last thing I took a look at was the cost element, and wanted to contrast it to building our own solution, if you would. We live and work here in Bergen County, New Jersey, right outside of New York City, very expensive labor market. It was pretty quickly obvious that doing it ourselves was not going to be cost beneficial. So we concluded that we were getting great value from Pacific, both in terms of the realization of the benefit and the cost effectiveness. So the conclusion was not only to proceed with Pacific and continue the relationship given our future growth, but we identified to governance and senior management, the network was providing value, and that was our step forward into the future to continue.
Great, Sean, thank you. Desmond, how about Johns Hopkins? What was the impetus behind them to outsource? And then also, to the organization, how did you overcome any apprehensions about outsourcing some of your operations?
Yeah, very, very similar. We embarked upon this journey with Pacific about 8 years ago. Prior to that, Hopkins was a little bit adverse to actually outsourcing, especially offshoring any of its work. We are pretty much a local company as well. Our philosophy is to hire our local community members, However, we understood around the time of ICD-10 that we needed an expertise that we probably was not going to be able to find. There was a real concern that there was going to be shortages of individuals with that skill set. And so one of the proposals that I had made was to look at alternatives outside of our community as well as outside of our organization. We actually had Pacific come in through a relationship with someone on our board at one of our community hospitals. They came in, we met, we talked, they left. And at the time, the decision still wasn't made to go offshore or outsourcing. And so we had a lot of conversation internally, and the then VP of Revenue Cycle Management came back to me and said, pretty much, Desmond, this is your project. This is what we need, and we need a solution. So I actually called Kumar and team to have them come back in. We had a second meet, and we pretty much laid out what we're trying to do. And we also laid out some of the challenges that we could face, specifically around socializing the idea of being an outsourced partner. And how do we get that into Hopkins leadership and mindset to accept it? And so, due to Pacific's great ability to communicate their skills and capabilities, they were overwhelmingly selected as the vendor to come in to support us. We realized that this is a new territory that we were embarking upon, and we wanted to be very careful that we didn't make any mistakes. And we were very clear working with Pacific that we couldn't make any mistakes. And so they were a great partner. They understood our challenges, and they came in to assist us. And as a matter of fact, we continue to build that relationship today.
Great, Desmond. And just to kind of add on to that, were there any apprehensions? Like, what was some of the things that you had to overcome from that in terms of getting that relationship off the ground, that partnership off the ground?
Absolutely. As I mentioned before, Hopkins is a very local-based company that likes to hire from the community. The greatest apprehension was that, one, they never outsourced anything, and certainly not offshore. So it was always a concern of trust. It was a concern around security. It was a concern around whether or not we're taking work from our own community and putting it somewhere else. And so the greatest apprehension was, how do we manage and control the work so that our patients will not be affected negatively in any way? And so we worked very hard on building out that plan, building out that vision, ensuring that all parties that were involved was always up to date with what's taking place and any potential risk that was along the way. So once we got past the initial idea and the concept of it, then we started to work on the technical specifications of how do we get it done. And then, of course, working with Pacific to ensure that they have the right security protocols in place, a lot of the policies that are needed to govern this type of work. And then that sort of helped us get past those initial concerns.
Thanks, Desmond. Recapping, it sounds we have some interesting insights from Sean and Desmond, and a couple of impetuses behind outsourcing, such as scalability, cost, being able to get those skilled resources that you may not be able to find in your market. And it also sounds like there's some challenges, like, hey, we have to have data security, compliance, all these things that are really important. So I think those are all really good points, and really kind of builds toward growing that relationship as not just a vendor, but a partner, as you said, Desmond, and really growing that relationship. So kind of building on that, what are some of the biggest challenges you and your organization experienced during the implementation process, right? We have done the vendor selection process, we've executed a contract, now we're in implementation. What were the challenges you faced, Desmond and John Hopkins?
Yeah, the initial challenges, one was putting the right policies in place. We had policies that governed our employees, our internal employees. We had policies that govern our third-party onshore, partners. However, we didn't have any international-based policies. And so one of the first things was to put those in place and ensure that our legal team vetted them and made sure that they were very comfortable with them. Other items that we had to really work towards is building up a relationship that looked at Pacific as not just as the industry call it, a vendor, but a true partner, and an extension of our staff. That was the key to making sure this relationship worked. The moment that Pacific was ever to be seen as a separate entity, that was going to cause major problems and concern with others within the organization. So we immediately start working on how do we make Pacific a part of our team? How do we ensure that when they come on board, that they have the same abilities, the tools, the resources that our internal staff had. And so we wanted to make sure that there was a mask over the fact that Pacific was actually an offshore vendor. As a matter of fact, we rarely even talked about it when we have internal meetings. We didn't go into the fact of saying, you know, they're an offshore vendor. We have a partner who's supporting us. Oh, and by the way, they're located in India. And so, you know, that was some of the things that we needed to do initially to get past the socialization idea of working with an offshore partner. When we look at internally, security was huge. We had to make sure that the security protocols was in place to the point of actually visiting. We had to go visit the facilities. We had to walk through. We have to make sure. We had to see where the staff worked. We had to see what security protocols they had in place at their location, and then be able to communicate that back to our security team. Working with another vendor, we are an Epic shop. So Epic has very strict rules as to access into their system. We had to work through the concerns of Epic and getting them access and being able to make sure that they had the right security templates in place. So there was a lot of just trying to understand what are the things we needed to have in place in order to make sure Pacific could be successful on day one.
Thanks, Desmond. I appreciate that. Sean, any specific challenges that Holy Name experienced during their implementation process?
Yeah, so our implementation obviously took place a long time ago, but what I would share is that and echoes something that Desmond said about, you know, cultural fit, you know, moving from this concept of being a vendor to being a partner and being an extension of your business office. That didn't happen right away. You know, we were very small in the beginning in terms of this relationship. And yeah, and in the beginning, maybe it was like a vendor relationship where you were just calling somebody somewhere and, you know, trying to make sure the bills went out. To evolve over time with focus and effort and intent on, particularly on Holy Name's part and Pacific's part, to become that comprehensive, integrated relationship, which, you know, took a while. And it took a presence of personnel on site. And that happened over a period of years. It just didn't happen, you know, in a 60-day period of time, given the scale that we started at. The other aspect I would share about transition is that while we transitioned a long time ago in terms of the, you know, the partnership itself, we transition practices every day of the week. As a community hospital, we're aligning practices all the time. Data transmission and data management is kind of a key concept for us, right? We're walking into a practice that's got a disparate EMR, disparate practice system, and how do we work with it? Sometimes we don't have time to put in our standard solution. We got to start anyway. And having a partner like Pacific is actually a real asset because they work with many different solutions and they can be very valuable and have been very valuable to us in terms of data management and getting what they need and we need to make sure cash starts the way it should.
Thank you, Sean. Kumar, how about from the partner side on this one? Let's hear about how the challenges that you may have faced. I'm sure you and your company have gone through, you know, dozens of these implementations. What are the key challenges or things that you have to overcome from the implementation side?
Thanks, Paul. So far, we have gone through more than 100 implementations. And in all the implementations, we have faced two types of challenges. One is the emotional challenge and the one is technical challenge. In the emotional challenge side, we have realized that it's very important for us to make the staff of the CBO of the health systems very comfortable with the concept of outsourcing. To win their trust is very, very important because by end of the day, we need their full cooperation and support for transition and implementation to be successful. So that is one part. And the second part of challenge is the technical challenge, where we have to ensure that during the implementation phase, transition phase, there should be no dip in the revenue of the client. And in order to ensure that, it's very important to create the right implementation team, a team of experts who are good with mapping the client processes, documenting all the workflows, even sending them on site at clients' offices to understand client processes, and then transfer that entire accumulated knowledge back to the outsourcing team 100% without any fault. So once the implementation begins and the transition begins, there is not even 2 or 3% dip in the client revenue. And we have been able to do it every single time. And that's why I believe Sean and Desmond and many other clients of Pacific talk very highly about us.
Gentlemen, thank you. And you all made very good points. And kind of just to recap, this is kind of what I gleaned for our viewers is, this is a partnership between the organizations and, Pacific or whatever vendor that you may choose. And you need to plan accordingly. You need to get buy-in from the stakeholders, get everyone on board. We need to have a strong knowledge transfer, standard operating procedures, robust training, technology integration, and data security. Desmond, you made a point, on-site go-lives, I think, are really important, right? Having resources at your facilities and sending your resources to the partner facilities overseas during those, all those things, I think really is what everyone's saying is really make for a smooth transition to, as you said, Kumar, minimize that cash disruption. Nobody wants to have any cash flow disruption. And that's really the key, right? We need to keep everything status quo, get that cash per visit, or increase it. It can never go down. So thank you very much for that. Moving on, as an organization, we've thought about it, we've decided to move forward, right? We've implemented now. How has that relationship and the partnership evolved over the years, and what have been some of the greatest benefits of having an outsourced vendor for your organization? Sean, what do you think?
Yeah, for us, tremendous growth here, right? I mean, our network, just in the 5 years I've been here, has grown 350%. We've gone from about 50 providers to north of 270. We'll probably be well into the mid 300s in 2021. And so the intimacy of our relationship with Pacific has grown with that growth. As I mentioned, the concept of being an on-site member of our team has evolved. That's been a real positive. In terms of very specific things, and I think Desmond also mentioned it before, that coding is a significant challenge, right, for us in this marketplace, finding the skilled staff, to do it. So for us, we've become more and more reliant on Pacific and their ability at a moment's notice to basically, get us the resources we need, whether it's a go live audit process that we conduct with all our providers or an annual audit process for compliance purposes. That type of growth we never could have kept up with on our own. So that's been a natural area for us. The cost effectiveness, continues to be there for us. And obviously one of the great benefits has been the scalability. So we would never have been able to kind of keep up with the pace in terms of trying to build this on our own if we were moving along, given the number of practices we brought on in the period of time. So they've been a great extension of our team.
Sean, I think you actually bring up a very good point there. In certain markets, it's very difficult to find talent and build critical mass to obtain efficient operations and scale. Compounded on the cost of those resources, competitors in the market, like you said, you're in Bergen County, it's a very competitive market. You're right outside of New York. Having an outsourced vendor allows you to scale those operations in an efficient manner and also quickly. So thank you for that. That's a very important point. Desmond, what have been the greatest benefits for Johns Hopkins in having an outsourced partner?
Well, I think, again, as Sean had mentioned, there's always a lot of transition in the healthcare industry. And when you think about healthcare and how it's sort of evolved over the last 20 years and probably where it's going to go in the next 10 to 15, you're going to need technology, you're going to need partnerships, and you're going to need a clear vision as to how to accomplish your goal. I think as an organization, Hopkins realized that in order to fulfill those, we needed to start adding those pieces to the entire puzzle in order for us to be well positioned for future growth. So when we looked at ourselves from a staffing need or a expertise need, we understood that we would be at a disadvantage, not only because of it being in a competitive market, it's also because, once you have folks here at Hopkins, they stay. And so that's a good thing. However, we're not always exposed to the problems of the industry like you would find with a partner such as Pacific. So they're being challenged with different health system problems on a day-to-day basis. We get the advantage of that knowledge when we bring them on board to help us. And it's a less time for us to have to retrain or train in general. They're actually coming in helping us by bringing in some of that knowledge and expertise. So the advantage is, one, we have a partner that we believe that we can grow with just based on their knowledge of the marketplace. As Sean mentioned, there's economies of scale that we gain from this relationship as well. We can flex up, flex down in our staffing needs as we need. And as well as we can look at technology as another bridge to where we need to go. So Pacific is actively, and Access as well, is actively looking at automation and different things as it relates to bots. Well, that's where we need to be as a health system. We need to be looking at how do we automate more of our processes to remove the waste out of our processes. And so by having a partner that gives us that ability, actually helps us get to where we want to go from our mission and vision standpoint.
That's great, Desmond. Actually, I kind of want to take that even a step further, right? You talked, how do you ensure compliance, security, quality, and leverage scalability and flexibility with your partner? And you did touch on that a little bit on the bots and the automation. Just kind of want to expand upon that because I think you're going right down in the right path.
Right. So when we think about security, we think about compliance. We look at privacy, especially HIPAA. We look at it from a very holistic perspective, and that is, how do we ensure that the patient is always going to have the quality care as well as the privacy of their medical records? And so we train our staff. We ensure that our staff, internal staff, understands all of these steps and procedures. Now, how do we now leverage our partnership and making sure that they have the same abilities and capabilities? Well, we don't treat them any different. They are part of our staff, as Sean had mentioned. They are part of our staff. So as we take our staff through these annual trainings that need to be had for security and compliance and privacy, we ensure that our partners, employees, are also going through the same thing. We also encourage them on their side to do their own set of trainings with their own team members. So as things are shifting and changing here in the US, we're always communicating back and forth with our partner to say, here's what we need to know now about regulations as it relates to payers, as it relates to the industry, and we need your folks to also be well aware and equipped. So it's all about training, it's all about communicating and not creating our own internal barriers by creating segmentation in employees. We keep everyone together as one set of employees, regardless if they're sitting in India or they're sitting here in Baltimore, Maryland, and we provide them with the same level of access to that information.
Great, thanks, Desmond, appreciate it. Kumar, from the partner side, how is Access Pacific Global working to ensure compliance, security, all those wonderful topics that we like to talk about and think about when choosing a partner? And of course, quality and scalability.
Of course, yeah. There are three very important and critical aspects to whole security, compliance, and quality parameters, I would say. So from security perspective, you need to understand we are operating out of 3 different countries, 9 cities, and 19 different offices, where we have more than 13,000 employees working. So from security perspective, all our offices across all the countries and cities are physically and logically secured. There are 24/7 security guards in the offices. We have 24/7 CCTV monitoring. There are 3 layers of access control system. So it's virtually impossible for an outsider who is not authorized to get inside the office. We are so secured. From compliance perspective, we are audited by some of the best audit firms of the world. We are ISO 9001, ISO 27001, and SOC 2 Type 2 certified. And to the best of my knowledge, we are the only RCM outsourcing company outside of the US, which is also high trust certified. And we maintain this certification on annual basis. So from compliance perspective, also we have taken care of all the compliance requirements. But the best part about the company is our quality requirements. So we maintain a team of more than 700 quality analysts at no cost to the client. It's completely our cost. And every single process is audited on daily, weekly, and monthly basis. In other words, every single production staff is mapped to a quality analyst who will be a Six Sigma expert, and that quality analyst will be responsible to ensure that at least 15 to 20% of the transactions done by the production staff is being monitored and the report is being published. This department is headed by a Six Sigma master black belt, and all the quality analysts working under him have a Six Sigma certification or knowledge of Six Sigma. We take a lot of lean projects also to improve the processes. So in combination of our security policies, compliance policies, and the quality policies, we ensure that client's data is secured, client service delivery is at the optimum level, and client is happy.
It's probably the most important thing, right? Keeping the client happy.
Of course.
Speaking of which, going back to the client or the provider side, Sean, what do you see as the key factors to maintaining an effective outsourced vendor relationship? What's working right now for Holy Name?
Yeah, so for us, it really comes down to goal setting, Paul. For example, we recently completed our 2021 planning process, which is a very comprehensive set of goals down to the practice level in terms of what we expect to see happen. We sit with Pacific, we share that. In fact, we even developed some of it with them as we're going along, given the data and information that we have. So that becomes one level of goal setting, in the relationship that becomes one touchstone that we look at. And from there, it becomes about transparency and reporting, getting the reporting that we need to understand what's happening and why, having daily, weekly, monthly conversations, around those targets, so that there are never any surprises for either one of us. And that's kind of the backbone of what makes it work over a long-term basis. I'm just touching upon revenue budgets as one example, but there are many others.
Great, thank you. Desmond, what's working for John Hopkins? What do you guys are looking for in managing your relationship with your partner, Pacific?
Yeah, I think if we have to look at a three-pillar approach, we look for openness, we look for honesty, and most importantly, transparency. And this is critical because we need to understand from all parties' perspective what is working and what isn't working. And if we can repair it, let's get past the solution phase. When we look at how things are structured today, we want to continue to grow and build a relationship to a much broader one, which we have actually. And that mainly is because of trust. We believe that our partner is here for us and the mission of our organization, as well as the betterment and the care of our patients. And so because of that, it continues to work. The relationship itself has grown over the years because, again, we started to understand better the needs of one another. As I had mentioned before, the flexing up, the flexing down, that's critical to an organization such as Hopkins, who's constantly looking at new types of projects that we like to kick off and sort of immediately find out if there's success. Pacific actually comes in and they're willing to run the journey with us. They're willing to take on the challenge with us. We're not always, accommodating them with the request, but they're always accommodating us. And so when we look at that, that tells us that we have a partner that's willing to work with us, even within some of those tight times, those hard times. And I think that'll continue to be the mission going forward and possibly the secret sauce to the relationship working.
Nice. And I think you make some great points there, Desmond, and the partnership to be successful, that openness, that trust, giving them the tools to be successful. Those are really good points. And that really transitions into, I think, the next question that we'll stick with you here is, how does an organization ensure that your tribal knowledge of payers' services are appropriately transferred and shared with a partner such as Pacific Global so that they can be successful?
Yeah, I think initially, and Sean kind of touched on this, when you bring your partner into the table and you begin to talk to them about the mission, the vision, and also any type of regulations, you begin to create a foster relationship of togetherness. And so for us, we want to bring Pacific in as part of those early initial conversations. So that one, they're aware of the direction of where we're going as an organization, but two, that they then can contribute to that knowledge base that we need to acquire very quickly as health systems are continuously changing across the US. And so by integrating our thought process, by allowing Pacific to be not only just folks that help us in times of need, but also be a strategic partner is critical to our organization. And I think that's it. How do we equip them with the tools? Is that they're at the table with us as we're talking about what our needs are, and then we're able to immediately address what they need in order to be successful.
Great, thanks, Desmond. Sean, how about for Holy Name?
Yeah, so for us, the payers don't exactly announce themselves in terms of what they're doing all the time, right? Once in a while they do.
You mean Aetna doesn't tell you that all the time? They don't send you out a...
Yeah. So the intelligence comes from a lot of different places. And the way they act, I think, is also pretty zip code specific, right? It's different in different parts of the country, even in different parts of the same state, maybe. It could come from the office itself, the physician's office. It could come on the back end in terms of denials. It could come over maybe from what the contracting people are experiencing. And so kind of coming back to what Desmond was sharing, it's all about being seamless and being timely in terms of transferring that information when you see it, experience it, and what are we going to do about it. Telehealth is a great example. Most of us got into that business recently, and those rules were changing daily, right? And so, sometimes it's just a simple grid that isn't so simple that you need to update an hour at a time, a day at a time, and getting it around to everybody so that everybody's on the same page in terms of what, payer X, Y, and Z is doing today, given what we're seeing or given what they told us. So it is part of that overall partnership and that effective site presence that makes it happen in a timely way.
Makes sense. I like it.
Yeah.
Kumar, from the Pacific Global Access side, what do you look for what do you need from organizations, and how do proprietary tools such as your ARC platform support this?
So for a company like ours, the life is more complicated as far as passing over the tribal knowledge to our people is concerned, because we are talking here about more than 70 customers supporting more than 200,000 physicians in the health systems. And every physician, health system, every location, state, city, zip code has got its own nuances in terms of payer-specific knowledge. So in order to have all these knowledge passed over to our people in the right fashion, we use a lot of technology, a cutting-edge technology, which is grown in-house, as you talked about the .arc platform. So we have a couple of knowledge management tools which helps us a lot. And they are very vast, massive tools which we have built over the period of many years. So whenever in the morning a person logs into the system in order to start the day, if there is any update in his or her team, any specification had changed, any AR coding billing rule had changed, the knowledge management tool will give a prompt to the person to go through the update and acknowledge the update, and then only the person can move forward and start the day. Otherwise, the person is forced not to start the day. So we ensure everybody reads all the updates properly. Similarly, our AR management tool also plays a big part to ensure the tribal knowledge is passed over. So what we do for a client like Holy Name or Johns Hopkins or any other client, we take all their payer specifications, denial related specifications, and we import that in a very unique tool which we have built called the decision tree. This is very, very unique to Pacific and Access Healthcare. So decision tree kind of forces the AR follow-up person to take the right steps in case of any denial. The notes also become standardized, and that eliminates the risk of any error in the account. Similarly, we have a lot of other tools using which we ensure that the tribal knowledge of the payers are not only passed over, but are also followed, because of which we ensure to our clients more than 97% accuracy, and so far we have been consistently meeting it.
Great, thank you, Kumar. As we keep building on this conversation, and we've all worked in the RCM industry for several years now. How has the RCM industry evolved over the years, and where do you see the future of this industry going, Kumar?
Well, I can say that in my last 20 years of being associated with this industry, I have seen this industry becoming more and more complex, with new reimbursement models coming like value-based care model, the insurance company squeezing out the providers in the hospitals and reducing the reimbursements for every procedure, including Medicare actually. That is making life difficult for all the healthcare providers. So I see a lot of automation, digitization of RCM taking place. Initially, this industry was uh, manpower-based industry. At this moment, this industry is manpower-based, but technology-enabled industry. I see the future of this industry as technology-based, manpower-augmented industry. And we are moving in this direction. If you take Pacific and our parent company, Access Healthcare, as an example, I mean, look at the amount of tools, technology, artificial intelligence, machine learning tools which we have developed. Uh, so, so we have spent millions of dollars on all these tools. And I'm sure that in future, more and more companies will be investing in automation tools, artificial intelligence, machine learning tool, and eventually automation will play a major role. For example, in Access Healthcare, our parent company, we have more than 1,500 bots deployed, and the number of bots are increasing by every passing month. So I think that's going to be future of this industry.
Yeah, I think the technologies, the automation processes in place for a partner to help drive down those costs to collect, increase efficiency. I think that's really where the industry is driving to. There's a constant pressure to do more with less. You said it was heavily resource driven at the beginning, and now it's becoming more technology based. And really, a lot of it comes down to driving that cost to collect. And I'm sure Sean and Desmond will talk in a second. You have to get that cost to collect in line. It's always on your mind how much money I'm spending to collect it. Right? If you're at 6%, how can I get that down to 4%?
And Paul, I'll just make one more statement here, and that is the benefit of coming to a technology-driven outsourcing company like Access Healthcare and Pacific, because we invest millions of dollars on this technology because we have multiple clients and we have the scale. A hospital or a health system might not be able to invest so much of amount. We have a dedicated team of more than 150 software developers. A hospital like Johns Hopkins or Holy Name may not afford a team of 150 plus software developers to develop the kind of technology which we are developing.
Very good point. Desmond, would you like to see where are we going in the future? I'd like to know.
Yeah, I think what Kumar had mentioned is very, very true. We can certainly look at it from a pure cost perspective, right? That we need to drive down costs in order to preserve as much as the revenue or find ways of not having as many denials. But I think it's more critical than just the cost element. It's also having the right skills on board as the industry continue to mature and change. Patients are still going to be seen from this day until the future. That care, that quality of care is going to be so critical to organizations in being successful. I might not want to come back to your facility because of the way I feel or how I was treated. And so how do we improve that? Well, we have to have technology in place to be directly in front of the patient as they enter our door. We got to be able to let them know that, we understand you, we are compassionate with you, and we're going to walk you through the entire patient journey. Now, it'd be great to have a person to actually do that, but that'll be very costly, right? So we're going to have technology that's going to be able to literally, as the patient comes in, we scan them in. It's going to be able to give them alerts to their phones. It's going to be able to give them alerts right on their records. They're looking at MyChart or whatever the other tools they're using. It'll also send them emails letting them know that their care has been in great service, and we appreciate being able to service you. So as you look at that continuum, it's going to be technology based. We're going to do our best once they come into the facility, and we're going to take care of them. But like Sean had mentioned, well, what happens if they don't come into the facility and we're doing telemedicine? We're going to have to still have that technology to be able to support that patient experience and also get the same level of quality.
Yeah, I think I want to touch on that. You hit a key point, that patient experience, that patient engagement. That's definitely on the forefront of everyone's mind as well, right? How do we get our NPS up, right? I have my MyChart app, right? I was in there this last night looking at my scheduled appointments, looking at my test results, right? But it's easy in how that I engage to. So I think that's a really good point. Sean, do you want to wrap us up for this question?
Yeah, just real quick, because I think Kumar and Desmond hit it really well. Technology is definitely the driver. It is going to push this industry further for all the mentioned reasons of quality, service, and staying in business. And it is a significant investment, no matter how you cut it. And a mid-sized community hospital like Holy Name, we couldn't do this on our own. There's just no way. So that partnership, that outsourced partnership with somebody like Pacific, absolutely necessary to continue to do what we're going to do.
Great, thank you. All right, one last question for the group before we wrap up. Right, COVID has clearly had an impact on all hospitals, health system, business operations. What is something positive that's come out of the post-COVID environment? So, what about you, Desmond? What do you think? What's positive out of COVID?
I think what COVID did was it removed some of the myths from healthcare organizations about remote work, at least for Johns Hopkins perspective. There was always a belief that I had to have my employee in eyesight, and that's the only way I can better manage them and also manage productivity. Well, what COVID revealed is that that's not true. If you have the right tools in place and the right monitoring package and also the right partnerships in place, you can manage and monitor from anywhere in the world. So what it did was it opened our eyes from the whole outsourcing, offshoring model. Now that most of our employees are at home today, it doesn't really matter where they work, right? You can actually be on a beach somewhere working accounts. How will we know? As long as you're connected to the internet. And so now the area of Pacific being in India is no longer a problem anymore. So COVID did that. COVID opened our eyes to the ability to manage without borders.
Yeah, it definitely debunks some of those myths that we had always been accustomed to, especially within revenue cycle, right? In that niche. So I totally agree with that. That's a great point. Sean, what about you? What's some of the positives out of COVID?
I think one of the big positives is the acceleration of telemedicine in a very short and rapid period of time. We've been trying to get providers for years. We couldn't pay them to do it. They just wouldn't do it. And in a matter of weeks, all of a sudden, everybody was doing it, right? They got the memo, so to speak. And so many benefits of it, right? Safer for patients, a different mode of treatment, right? For us, unfortunately, we had many thousands of COVID positive patients. Through telemedicine, we were able to keep them out of our ED, monitor them properly, bring them in when they needed to be. So a great change there. Consumer friendly, the payers got on board, led by Medicare, and the commercials pretty much followed them. So for me, it became something very good that came out of something very, very challenging and very hard.
Definitely agree. Telehealth is here to stay, definitely.
No question.
Kumar, why don't you bring us home? What do you think?
Yeah, I think because of COVID, more and more hospitals and health systems are seriously thinking about outsourcing, because in outsourced model, the cost is a variable cost, wherein in-house model cost is a fixed cost. So variable cost reduces the financial risk for any health system or the hospital. So that is one advantage which I see for outsourcing companies like us. The another advantage which I see is the more and more adoption of technology. I remember many years back when we started developing our in-house automation tools, many of our competitors were asking that why are you guys spending the millions of dollars in these tools? And we knew that the future of the industry is automation technology. So we invested, in those technologies. But when COVID came and suddenly India went for the lockdown and everything was locked, nobody was allowed to go out of the home. At that point of time, we realized the value of this investment because we had developed some cutting edge in-house monitoring tools also. And that helped us bring our employees up and running from home. More than 90% of them actually within 1 week, whereas a lot of our competitors they struggled. And it took, if not months, at least weeks for them to bring their employees back in the working mode. So these are the two big advantages of COVID, which I see. One is more push towards outsourcing, and second is more push towards technology, automation.
Great, thank you. Sean, Desmond, Kumar, thank you for joining us today. For our viewers, thank you for watching. I encourage you to submit your questions in the Q&A box, and someone from Access and Pacific Global will respond to you in 24 hours. Thank you.
Thank you very much.
Thank you.
Thank you.